be fashionable and correct your vision, but don't you hate it when you have your glasses, and then you have your readers, and then you have your prescription sunglasses, all that stuff to fumble through? Well, if you don't want to deal with any of that anymore, then please welcome Dr. Colby Stewart, ophthalmologist and LASIK surgeon. Good morning.
Thank you very much.
So I watched this happen this weekend with a friend of mine. She was in her glove compartment. She's digging through. I go, what are you looking for? She goes, I have prescription sunglasses because these are my regular glasses. Now I got to get my prescription sunglasses out. And then, of course, she always has to look for her readers. She has 3 sets at home. She has 3 sets in her office and 3 sets in her car.
Yeah, I mean, well, that's one of the things about what's so great about LASIK surgery is to be able to kind of, take all those glasses and put them away. And really, patients love to be able to get a pair of sunglasses without a prescription. They just love that.
It's a little bit cheaper, too.
Oh, yeah, absolutely.
Or you like to just wake up in the morning and not have to put contacts in the whole bit if you do contacts as well. Okay, well, here are the questions that she had. She goes, okay, but I'm just afraid to have surgery on my eyes. This is one of the safest surgeries you can do. I did it years ago.
Right, it is one of the safest surgeries you can do. And everybody's nervous when it comes to having LASIK. I mean, just the idea of somebody working on your eye. But this procedure, we use numbing drops to anesthetize the surface of the eye. You feel a little pressure during the procedure, but usually, on average, to do both eyes takes about 6 minutes. We do it in an outpatient setting in the office, and the patient, when they sit up from the table, can already see almost immediately. So the next day, I would say about 95% of our patients see 20/20 or better.
Yeah, I saw better than 20/20. It was crazy. I could almost see through people, I thought, right? Okay, so the other thing she was asking, she goes, well, I can't get it done because I have astigmatism, and she also does readers, but she also needs to see distance as well. You can negotiate a lot of that stuff.
Yeah, that's right. I mean, one of the things is when we get over 40, we need reading glasses, or we need bifocals in most cases. Some of the patients that come in and see me, especially patients that are friends of mine, are my age, 50, and they come in and they need reading glasses. We can do stuff with LASIK to make one eye help with the near vision in one eye. It's called blended vision.
Yeah.
And it sounds crazy that people would not be able to tolerate it, but 85% of the patients enjoy it and can be able to get out of their distance glasses and their reading glasses.
Yeah, correct both problems at the
That's
same
right.
time. And when we talk about the word laser, that's the other thing that scares people. But I literally laid down and it was just like zzz, 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 and that's basically all I remember. And I didn't feel anything, and it was just all of a sudden I woke up and I could see.
Right. Well, we use 2 lasers in the LASIK surgery that I do. One laser is to create a little thin flap on the surface of the cornea, and the other laser is a cool beam laser, which basically doesn't create any heat. You don't feel anything. It's just reshaping the surface of the cornea to make it so it's customized to whatever your prescription was.
Yeah.
And we put that flap down. It seals back in a relatively short time, and patients can see amazingly the next day.
Yeah, yeah. I mean, it's like when you say lasers, it's not like Star Wars and like Darth Vader's arm is falling off or something like that.
I think a lot of patients also are worried about, they're worried about pain. They're also worried about seeing something, and the main thing that patients are worried about is doing something to mess it up during the procedure. Yeah. That's the main fear.
And you
really can't. I mean, and not that I don't trust the patient, but I don't trust the patient. I mean, I don't want that. I mean, I want to keep, we keep their eyes open when we need to, and we're under total control so that the patient doesn't really have to do anything except for a few things like look at a blinking light here and there.
Yeah, and this is something that you actually grew up with, and we've mentioned this before, but I think it bears worth repeating that you grew up alongside your dad in the surgery room.
Yeah, that's right. So my whole life, my father was an ophthalmologist. He's one of the founders of Houston Eye Associates, a big group in Houston that we do specialties of all different types of eye surgery. And so I grew up in the summer being in his office and working with him, and I saw the way that he dealt with patients, and that's when I knew that this is something that I wanted to do.
Speaking of the way he dealt with patients, so the way you deal with patients, you see them through the entire process from screening to post-op.
Right. I think it's important if someone comes in to see me for a LASIK evaluation, I'm going to talk to them. I'm going to walk them through. I'm going to do the refraction, make sure it's perfect, go over the diagnostic tests, make sure they are a perfect candidate for the procedure.
And what makes a perfect candidate?
Well, anybody that's nearsighted, farsighted, has astigmatism. There's a wives' tale out there that says that I can't do LASIK because I have astigmatism.
Yeah, and I have one. I thought I couldn't do it. But
we've always been able to get it, really, since the lasers came out. And the other is patients will tell me, I heard that I have to have it again in 10 years. That, too, is not really true. I mean, we do the procedure to last over a lifetime.
Yeah, all right. So once it's done, it's done. In fact, you personally call patients the night before, make sure they're all...
Right.
Yeah.
I mean, this is part of the extra touch. I mean, I want to make sure that the patient's doing well, call them that night, make sure that they have my phone number if they have any questions or concerns. And it's important, especially if someone's going to be dealing with your eyes, you want them to care and have that special interest in
well, here's the problem, Dr. Stewart. I got some single friends who are looking at having LASIK, and there's nothing wrong with their eyes.
Yeah,
they heard that phone number part, and they're like, there's nothing, girl, you know who I'm talking to. There's nothing wrong with your eyes. Okay. For special offers and a chance to get a free LASIK procedure, text the word LASIK, that's LASIK, to 31996, 31996. For more information, visit stewartlasik.com or call this phone number at 713-358-4335, 713-358-4335. And you're right, you just start seeing, right after that surgery, you see better already.
Right.
All right, thank you. In fact,